Okay, well, welcome to Between Service and Science, episode 3. On this episode, we have two authors in the room. Dr. Sarah Petry and Dr. Beth Gifford will discuss their article which explored aging in Gulf War veterans. That article is Characterizing Deficit Accumulation Among Gulf War Era Veterans, and it was published in the Journal of Frailty and Aging in 2024. So let me introduce our guests. Dr. Sarah Petry is a postdoctoral fellow in the Population Science Training Program at the Carolina Population Center at the University of North Carolina at Chapel Hill. Dr. Petry is a mixed methods demographer specializing in policy determinants of health and well-being across the life course, as well as looking at aging outcomes in the 1990-91 Gulf War era veterans. Dr. Beth Gifford is a research professor in the Sanford School of Public Policy at Duke University and a statistician with the Durham VA Cooperative Studies Program. She is a health services researcher and demographer, and a focus of her research is also the health of veterans who served during the 1990-91 Persian Gulf War. So Dr. Petry and Dr. Gifford and their team wanted to see if Gulf War veterans with Gulf War illness were aging more quickly than Gulf War veterans without Gulf War illness. Welcome, Drs. Petry and Gifford. Thanks for joining the Between Service and Science podcast today.
Thank you so much for having us.
Yeah, thank you. It's great to be here.
So we'll get right into it. I think maybe the most important background question is what's going on with Gulf War veterans and aging? What do we know about this?
Sure. So I'm Dr. Beth Gifford, and I'll take this question. Studying aging is a relatively new angle to examine the health of Gulf War veterans. Our prior research has suggested that among Gulf War veterans, younger veterans had a higher risk of developing the symptom pattern consistent with Gulf War illness. And in terms of examining the longer-term health outcomes of Gulf War veterans, a few studies have been conducted. So one was among our Fort Devens cohort that compared those veterans with the civilian population and found that certain military-related exposures were associated with increased risk of specific health conditions associated with aging, such as high blood pressure, diabetes, arthritis. Another study among over 400,000 Gulf War veterans who use the VA for their health care found associations for female veterans with a higher risk of frailty and accumulating some more health conditions relative to non-deployed females and deployed males. And then there's one more study that I'd like to mention, which was another study of veterans who use the San Francisco VA health system. And that study found that Gulf War veterans who met the symptom criteria were the most likely to be most frail. And so combined, what these studies are suggesting us is that there's a lot of factors related to demographics, military-related experiences that are associated with health outcomes, and we're currently in the process of unpacking those.
So obviously we all get older as time moves on, right? And in this cohort too, even if you were 18 when you were deployed in 1990 to the Persian Gulf War theater, you're now 35 years older, so you're at least 53 years old, right? And so this question of aging, I guess, becomes more critical. Do you have any other thoughts about what we know about measuring aging in a population like this? What are some of the ways to do that?
I can start off. So this is Dr. Petry, and in our work, we're looking particularly at the accumulation of deficits or the accumulation of different health conditions that increase with age. So things like hypertension, arthritis, hearing loss, these are all conditions that we would expect to see in older people. So the relative rate of accumulating those conditions could be thought of as a measure of aging.
Mm-hmm. So it's almost like a score, right? You're kind of tallying up how many different diseases a person has, and some people get a disease earlier than others, and the more quickly your score goes up, that's a proxy for getting older.
Yeah, exactly.
So in your study, you used the deficit accumulation index. Can you tell us how you calculated that?
These veterans can report the timing of onset, so how old they were when they were first diagnosed, and out of the 70 conditions, we're able to construct an index or a proportion. Out of 70, how many does a veteran report, and how does that change as their chronological age increases? Based on prior work, we use a cut point of 0.2 or 20% of those conditions, which represents about 14 of those 70, as a measure of substantial deficit accumulation or substantial frailty, where you start to be highly at risk of some of those adverse health outcomes like hospitalization or even death.
So that I like that scoring system, right? I'm going to calculate my own score and figure out where I am in that frailty index. So, Doctors Gifford and Petry, what did you find in your study? What are the most important findings that you want us to take away?
And I'll let Dr. Petry answer that.
Great. First, and I think most importantly, we find that veterans who have Gulf War illness are accumulating substantial deficits at much younger chronological ages than those without Gulf War illness. So as a result, these veterans who have Gulf War illness are spending a much greater number of years in this state of high frailty, right? That vulnerability to a variety of negative health outcomes compared to their peers without Gulf War illness.
And can you share like how much worse off are they? Like what would be the measure if we think about this as a score? Like what's the score of those Gulf War veterans with Gulf War illness?
One of the key differences that we find is that at the time of the survey, or right before the survey in 2013, among veterans who don't have Gulf War illness, only 2.2% have reached that state of substantial deficits or frailty. On the other hand, 20% of veterans who do have Gulf War illness have reached that state of substantial deficits.
Wow, that's almost 10 times as much substantial deficit in the Gulf War ill group. So let's talk a little bit about how you characterized Gulf War illness in your analysis. How did you decide whether somebody had Gulf War illness or not?
A veteran would have had to have told us that they had had a symptom in at least 2 of the 3 domains. And those 3 domains are pain, fatigue, and mood cognition.
What impact do your findings have on the care or health of Gulf War veterans with Gulf War illness? What do you want clinicians and patients to think about or know?
I would like some of this to be a little bit of a validation from the veteran's perspective that we are seeing physiological measurable differences in their health. From a clinical perspective, I also think that it implies that when a veteran or an individual is saying that they have these symptoms, that it is time to intervene early and to look for opportunities to address the health conditions that we can and to maybe monitor their health.
So perhaps a clinician would talk to their veteran with Gulf War illness and say, you know what, maybe we should start thinking about moving up the timeline on some of the screening and preventive health measures, perhaps? Is that where this might end up?
That's what I'm thinking. I'm thinking especially as that the chronological age might be projecting a healthier outlook than we should be, and that these symptoms are real, these symptoms are connected to future health outcomes, and we should add that into how we're monitoring the veteran's health.
So any other points that you guys want to speak?
I have one other thing I want to say.
Okay, good.
If veterans are able to seek primary care, to seek preventative care, to manage these conditions, there's a real way in which veterans can improve their quality of life by partnering with physicians and ensuring that all of their needs are being met, not just their needs related to service or related to unrelated conditions.
That was great.
That was nice.
I love that. Thank you for taking the time to share your results with us, Dr. Petry and Dr. Gifford. We really appreciate it. I'd also like to acknowledge Nick Davey and Zach Helmer-Jonke, who have been instrumental in getting this podcast up and running. It's been 35 years since Gulf War veterans were in the Persian Gulf, and for those with Gulf War illness, that's a long time to suffer with chronic symptoms. It seems we're getting closer to understanding this condition and its impact. Please hang in there. This podcast is developed in collaboration with the Gulf Coast Center for Precision Environmental Health, and we appreciate their support. Thanks for listening. Let's keep searching for answers between service and science.